Dr. Jordanna Quinn today is with us. She is a doctor of physical medicine and rehabilitation, and we're going to talk about optimizing your physical and mental performance just in 30 minutes per day. How can we do it? Welcome to my show, Dr. Jordanna.
Thank you. Thank you for having me.
Yeah. Okay, tell me about yourself first and your history. How did you become a doctor, especially for physical medicine and rehabilitation, and what are you doing now?
Yeah, that's a long story, but essentially, I have wanted to be a doctor as long as I can remember. I think honestly, in 7th grade, I saw surgery on TV, and I was like, I want to do that. And I've always been scientifically minded, like love the sciences, and also always been an athlete. So that'll kind of all come full circle. So yeah, I don't come from a family of doctors. I'm the first doctor in my family. So it definitely was just inner driven that I wanted to be a doctor, and I'm an empath. So I want to help people and all of that. So it just kind of fit my personality. So I made it happen, worked really hard in school, and became a doctor. So I am actually a doctor of osteopathy, which is, for those of you who don't know, I'm a DO as opposed to an MD, which essentially our schooling is exactly the same, except that DOs also learn hands-on approach to care. So we learn hands-on manipulations. We do, and often it's a more holistic approach. For example, in my medical school where I was learning cardiology, I also learned more in depth about the nerves that go to the heart and how they can affect your spinal cord. So sometimes if you have, for example, something wrong with your heart, you could have pain in your spinal cord, or if you have something wrong along like the upper thoracic spine, it can affect your heart. And so that's a very basic kind of overview of a DO. But the reason I became a DO is because when I was in college, so I had studied physiology and neuroscience, and I was just kind of disenchanted with the medical system in America at that time. And I thought, I really want to help people, but it just didn't seem to me that MDs as a whole were the type of person I wanted to be. And obviously I'm over stereotyping, but that's how I felt when I was in college. And so I was like, there's got to be some other way where I can really affect change within people without just prescribing meds. And I honestly don't think I could put those words to it at the time, but that's definitely how I felt. So I honestly went to the library and I did a bunch of research, and I looked into traditional Chinese medical school and Ayurveda, and I found Doctor of Osteopathy. And to me, that made sense because I still, again, really liked the evidence-based medicine and the science, how I understood it as a Western person. And so I was like, okay, DO sounds much more holistic. So I applied and I went to DO school. And then once I was in medical school, everything was interesting to me. I quickly actually decided, outside of my 7th grade self, that I did not want to do surgery. Orthopedic surgery was still on the list, actually, but I wanted to treat athletes, and so sports medicine was always very high up there for me. But I also loved kids, and I kind of loved a lot of things, but kids and sports medicine were two of my loves. And then during medical school, you have to make a decision, and I discovered a branch of medicine called Physical Medicine and Rehab. And what Physical Medicine and Rehab is the study of your physical health, the study of movement. So anything that makes you not move normally. So I went into that residency, and we learn anything that makes you not move normally, from brain injuries to spinal cord injuries, orthopedic injuries, rheumatologic conditions, neurologic conditions. Anything that affects your kind of muscular and your musculoskeletal system. And again, as an athlete, that made sense to me. I also pretty quickly realized that I did not, for example, want to do primary care because I felt like it was, or at least where I had done rotations, it was begging people to take care of themselves, So I would see patients who were, overweight and had high blood pressure and diabetes, and they would literally come in and say, well, you didn't give me a pill that's, good enough, or, whatever the case may be. And it was so interesting. And so I felt that in physical medicine and rehab, the patient had to do, 50% of the work, and I could be there with the patient, but it wasn't a blame game. It's like, well, if you don't move, it's your fault. again, that might sound terrible, but it was kind of true. I really wanted the patient to take responsibility for their health. And I will be there 155% with you, helping you along that journey, but you do have to take responsibility for your own actions and your own health. So that's how I ended up in physical medicine and rehab, which is a 4-year residency program. And then immediately when I got out of residency, I wanted to practice in the musculoskeletal sports medicine realm. I actually got a fellowship in sports medicine that I declined because I was pregnant and I didn't want to move once and then, just to like another state and then move somewhere else to get a job. And so I figured I could just practice on my own, which I could. I mean, my residency was very in depth in the sports medicine part of physical medicine and rehab. So we had really great training. So came out to Colorado where I got a job and was told that it was a musculoskeletal medicine job. And it turns out that it was a complete lie, actually. And it was a pain management job, which is part of our training. But it was not at all what I thought I was getting into. And so I ended up honestly prescribing huge doses of opiates to just this patient population that wouldn't take responsibility for their health. And I did a ton of spine injections, and that was fun to me. But I mean, I would talk to patients until I was blue in the face about health. I mean, which is what interests me. I love health. I mean, it makes sense to me, probably based on how I was raised and also being an athlete. Like, just if you eat well and you exercise, not that like all of your dreams will come true, but a lot of your dreams will come true, and we'll get there. It's important. Like health and healing comes from within and comes from what you eat and how you act. And we just really, as physicians, don't learn that. And also I think as a human, or at least the American population, don't understand that we're so far removed from like what we put in our mouth affects our health. And again, back to the blame game. We like to blame our genetics and we like to blame our environment. We don't like to just take responsibility for what we do to ourselves. So I was in this type of pain management job where it was a lot of that. And I would just come home and honestly like cry to my husband. Like, I beg this person to take care of themselves. And, they won't. They just want another pill. They want another pill. I mean, I remember having like a 20-something-year-old patient who came to me on, I forget, ridiculous doses of OxyContin and telling me that, she had back pain because of bad genetics. And meanwhile, she weighed 300 pounds. And like, she would not listen to me that her weight is part of her problem. She was like, it's just genetics. It's not, and just stuff like that I'm like, oh my gosh, like, this is not where I need to be in medicine. And I literally would talk to 100% of my patients about their health, but they didn't want to hear it. So that's kind of what led me to where I am today. At that time, I had a couple of actual sports medicine patients, and in competitive sports, you can't take oral steroids or do injections for like a rotator cuff tear, anything before a game, depending on what your sport is, because you can't have steroids in your system because they're considered performance-enhancing drugs. And so I had a handful of patients who needed another treatment that wasn't steroids, and they couldn't take meds or they didn't want to. And so I had heard of in residency something called platelet-rich plasma injections. And what that is taking your body's own blood, centrifuging out the platelets, and then injecting them back into an area of injury like a shoulder or knee or ankle to induce your natural healing response within that joint so that it heals itself. And so I had referred a few patients. I mean, I did a Google search of, who does PRP injections close, found a clinic, sent them there. There was another patient who had a very terrible neurologic condition called complex regional pain syndrome. And she didn't want any of the kind of normal Western medicine treatments. And so again, I did another Google search of like, who does alternative treatments for this? And actually I knew a neurosurgical PA at the time who was one of the most intelligent people I've ever met. And he was like, oh, there's a doc in town doing IV magnesium for this condition. You should send her to him. And I Googled it, and it's the same doc who did PRP. And this was, I mean, we're talking like a year apart or something. It was a long time. And I thought, this doc does everything that or everything. I mean, I knew two things, but seems like he's cool. He does things that just make sense to me, like using natural medicine. What does he do? So I wrote him a letter, and then kind of long story short, after shadowing him for a year, he ended up hiring me and then taught me a field of medicine called anti-aging medicine, which encompasses what's now broken up into little pieces of functional medicine and regenerative medicine. It encompasses some aesthetics. And so I worked for him for a decade and then opened my own practice 2 years ago. So that's my story.
You are doing the functional medicine as well. I'm a functional medicine practitioner too, that's why.
Oh,
So it's so interesting, your story, and to see that you found out that natural healing and actually holistic medicine can help your patient. As you said, yes, people expect to have fast healing. That's why they like pills. They,
totally.
yeah, they think, oh, if I take these pills, that's it. So that's why even for my asthma, I just had puff, and from one doctor to another one, they just gave me different puffs. Because you have the temporary relief from it, and then you said, oh, that's it, you're done.
Right.
But because the root is still there, you may get it over and over again. Yes,
Totally.
yes, that's so interesting. And with the anti-aging, you said, right?
Anti-aging.
Anti-aging, what did you do with that? And tell me more about that one too, please.
And so I still do a lot of that. So again, it encompasses, I mean, for example, I see a wide variety of patients now. The regenerative medicine component of my practice is where my heart is. I mean, as an athlete, I love helping people get back to doing their sport, and so that's super cool to me. I mean, and I love doing procedures still. But it never comes without, I mean, so I see some people or I see a lot of patients who come to me, for example, for just hormones but everybody, at the root of everybody, everyone wants to feel better, no matter what their problem is. So if it's knee pain, if it's knee pain, or if they're tired, or they have digestive issues or whatever. So even my patients, let's say, that think they're in very good health. So I have a good athlete population that are in very good health, like competitive athletes, some professional athletes. But they want to optimize their health. And so anti-aging is more of, we're not really treating disease. It's a lot of preventative medicine, but kind of taking preventative medicine like on steroids, because we're preventing disease, but they're already probably super healthy. So, we go over actually everybody's, stress levels, sleep, diet, exercise. I mean, no matter what, I get a good log of those things, but there are always some things that you can tweak or optimize. So I do an extensive blood panel, or a pretty extensive, kind of a mediumly extensive blood panel on most patients. And then, we talk, so for example, if someone's hemoglobin A1C is 5.6, okay, well, sure, you're not diabetic, but you're right under pre-diabetes, which is the actual definition. So we spend a lot more time talking about, simple carbohydrates and what exactly they're eating, or their genetics, and that sort of thing, because while they don't have a diagnosis, we want them to be 5.1 or 4.9 or whatever they can be. So we're optimizing their health. So that's what kind of encompasses anti-aging. It's like, if your blood pressure is 130 over 95, to me, that's high. Either we're going to treat it, or we're talking about high blood pressure. We're not waiting until it's, 180 over 100 to then diagnose you. So that's kind of the anti-aging component, is it's just taking preventative medicine, but making sure people are truly optimized, so they have a lot of levels of things, as that of a 25-year-old, or put a number on it, and it's not all about numbers, it's about feeling good too. So my approach to care in general is, what are your goals as a human? And as you know, as a practitioner, they're very different for people. Some people want to have a high libido, some people want to lose weight, some people want more energy, some people want better sleep. And while they're different, they're all kind of the same also, and so it's really just optimizing what someone wants. But sometimes, you have to do the internal work first. But the good thing about what I do is, a lot of my patients are willing to put in the work. I see very few people these days who play the blame game.
So I'm going to talk about your topic, optimizing your physical and mental performance in just 30 minutes per day. I'm very curious to know about that. But we have few second break and come back again. Please subscribe to Panta Calhoun Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching. Okay, tell me about this. How can we optimize our physical, mental performance in just 30 minutes per day?
Okay, well, it's not obviously as simple as it sounds, but I think it's a great title. And I do think kind of the long and the short of it is we can get there. So you're not going to, go from eating chocolate cake for breakfast and ice cream for lunch and, whatever for dinner and never exercising and never doing any mindset work or meditation or anything to spending only 30 minutes a day on 100% of the things and getting to your optimal performance. So I would say two things is one, typically this is targeting people who, again, are already pretty self-aware and healthy. But even if they're not, we can focus on a few of those things. And eventually you can get to the place where you're really spending 30 minutes. I prefer 30 minutes twice a day. But 30 minutes a day on your health, just focus on your health. So it's very geared towards, like, I have a lot of lawyers and people who are high performing in the business space. And, everyone doesn't have time for anything you want to tell them, right? You got to do physical therapy. Well, I don't have time. You got to eat healthier. I don't have time to cook. You got to sleep more. I don't have time to sleep. So 100% of people say I don't have time. So I came up with this because I thought, well, what would I want? Because I also don't have time to do anything, but I make the time to exercise, 5 times a week. I make the time to meditate 5 times a morning. I make the time to cook my family dinner or cook dinner 7 nights a week or whatever. So it's A, what you prioritize, and B, this would appeal to me. And so so again, it's not starting out with 30 minutes a day, but it's getting to the point where A, your body is trained to do the right thing, and B, you know what to do, and then you do it. So for example, often for me, when I go to work out, I'm a mountain biker. There's no way I can get a good mountain bike ride in 30 minutes a day. But when I'm not on my bike, I'll do a 22 or 30-minute HIIT workout. And so that's it. Like, but it's focused. I'm working my butt off in those 30 minutes. There's no playing with my kids. There's no talking. There's no anything but wanting to throw up for 30 minutes, pretty much, when I'm working out that hard. So you can do that. You can, I firmly believe you can meditate when you get to the place where you can actually, so you have to practice for however long it takes you to sit and focus on your breath. And that doesn't happen overnight, because I'm sure everyone's like, I can't shut off my mind. It's true. I can't either, but I've been meditating for 2 years now and I've gotten better at it. I still, when times are stressful or I have other things, my mind is not completely blank, but I for sure know that meditation has made a difference in my life. So I wake up and I try to do it 20 minutes a day, and then, including like a gratitude practice. And so you can do it 30 minutes a day. I assume most people aren't going to exercise do a 30-minute HIIT workout every day. So you do a 30-minute HIIT workout Monday, Wednesday, and Friday. Do a 20-minute like mindfulness practice or whatever you want to call it, meditation, gratitude practice. Do it for 10 minutes a day, then do 20 minutes of thinking about what you're going to eat during the day. If you cut up your fruits and vegetables on Sundays, I cut up at one point, I have a family of 5, so I go to Costco and I buy huge packages of fruits and vegetables, and then I spend my time cutting them up. So when I'm making cook all my own meals, I make my lunch. It literally takes 5 minutes to pack a lunch or to throw things in, stir fry something for dinner. So I might be oversimplifying this and I can kind of go into more detail, but you can get to the point where you can really, once you know how to exercise, you can get a good workout in 30 minutes a day. Once you have practiced mindfulness or meditation, you can slow the thoughts down and focus on your breathing in just 20 minutes a day. And then again, spend the other 10 minutes, on whatever we talk about, cooking, making yourself a healthy lunch. And so I really do believe that, like, it doesn't have to take 3 hours of your day to live a healthy life, which is really what people are afraid of. Does that make sense?
Yes. Even like I started with the sit-up in the morning, and then you can do it 10 like sit-up, push-up, every day, and then you can increase it. But that's going to be part of your routine, and you get
100%.
used to it. Exactly. Yep. And meditation, as you said, 5 minutes, 3 minutes, even 3 minutes.
Totally.
Quality meditation really helps you. Sometimes I don't want to think. I said, okay, done. I just want to sit somewhere and don't think about anything, anything. Sometimes cooking helps because while you cook, you don't think about other stuff. You
Totally.
just So yeah, as you said, yes, you can if you really prioritize and if you really take care for yourself. Like if you feel your body really worth it, you do it.
Oh, 100%. I mean, again, I hear all the time that people don't have time. I'm like, no, I just started a business. I have 3 small kids and I support my family and I exercise pretty much every day and I meditate and I eat healthy. Like you can do it, but I prioritize that. Like what I don't prioritize is TV. I can't talk to my friends or people about what's on like Netflix. I don't care. Not that I never watch TV, but like I just like I'm so far behind on the things. And I think I watch Netflix. I mean, probably on average 20 minutes a day, maybe 30. Like I don't care that much, and that's like including maybe I watch a movie on the weekend. It doesn't interest me. I wake up I mean, I'm pretty much working out by 6 or 6:30 almost every single morning. I'm a morning person, so I also know I'm not going to work out in the evenings. I mean, I also feel like I can pack a lot into like a 1 minute span. But again, even meditation, when I started, it was very difficult for me.
Yes.
And sometimes it still is, but I can still pack more into a 5-minute meditation or mindset than 2 years ago when I started, because I can, and I also because I don't beat myself up over it, right? Like I know obviously when I'm super stressed out is when I need it the most. And if I can't shut off my mind, that's okay. It was still valuable to sit for 5 minutes and focus on the breath, even if my mind wanders every 2 milliseconds, because honestly, I heard someone say this and it so much resonates with me. Even if I'm trying to focus on the breath for 5 minutes every day, it's 5 minutes where I'm not stressing out about the rest of my life, which is so important because it does change those cortisol patterns in your brain and the neuroplasticity of your brain. And it's just, you have to work on, and that's the other thing is, the more you work on, again, all the categories that I think are important, which are stress, sleep, diet, exercise, mindfulness, meditation, I put in the stress category. And then the things that you and I can help people with, which is actually like, whether it's prescriptions or whether it's supplements. I mean, those are, or, regenerative medicine, those are kind of the categories that people can't necessarily do on their own, but all of those things are important. And especially in the optimal performance kind of world. But you have to make those neural connections first before you can get to the 30 minutes a day is what I was saying, right? Like I couldn't do a HIIT workout. I mean, I've been an athlete my whole life, but I couldn't wake up tomorrow and I don't know, go play professional football, right? Without training. Like, so you have to train before you can get to the point where those things are more productive and you're stronger and you're more powerful or whatever the case may be. So, but I do, like I said, see a lot of high performing athletes or high performing professionals who want a quick fix. So going back to what you said about everyone just wants the pill, but there is a quick fix, but sometimes it takes a lot of work to get to the quick fix.
Exactly.
So, so I do see people who want, more cognitive performance. And then, I mean, we could talk about things if you want to, like specific things for that, like, I mean, IV NAD or IV, things that are not FDA approved that
I don't
work.
know what IVN. What is IVN?
NAD.
Uh-huh.
It's a specific form of B3 that works in the Krebs cycle. So, NAD turns to NADH, and then you take an electron and then you have more energy. So you can give people NAD via IV form, which specifically affects the Krebs cycle within the mitochondria. So you're really working on mitochondrial health, improving energy, and then improving cognitive performance. And so it's really working on a very obviously cellular level to affect change intracellularly, intramitochondrially, so that people do well. So again, I see a lot of that, in the performance space. And I mean, it's not on the World Anti-Doping Association website. I mean, because you can't A, measure it, and B, you're not doing anything. You're not putting in a foreign substance into your body. You're you're putting super therapeutic doses of a natural substance into your body that you're going to urinate out anyhow if you don't need. But after, I mean, so many people need help with their mitochondria, which is not even my specialty, but that's just a small part of what I do. And it's just super cool to use a natural medicine and see huge changes in people, and they just feel better and can perform better. Or I don't know, I love it so much.
Yeah, me too. It worked for me for pregnancy and getting pregnant, because I know you have a lot of women have fatigue. They don't have enough energy to produce good quality eggs, and these are most important part of it too, especially when you do it naturally, which much better.
Absolutely. But, in saying all this, I'm not anti all medication. I don't think all medications are created equally by any means. And I think we overuse and abuse some, and maybe, I don't know that I think any are underused, but I do think they serve a purpose. And so if sometimes there is a time and a place to prescribe medications, or prescribe a medication until you can get, I don't know. I mean, I don't really like Ambien, but just because people know what Ambien is, if people can't sleep, and then nothing else is working in their life because they're not sleeping, if they take Ambien for a week, get some decent sleep, and then can
Sleep
improve.
is so important. I know it now because I have a 3.5-year-old girl.
Yeah, right. But then right. And so you go a little bit crazy, I mean, when you're not sleeping. So, but I guess my point is if you take some medications, even for a short period of time, to get to a point that you need, because then you can recover during the day and be a better human, there's nothing wrong with that. In my opinion, it's just when you don't address the underlying cause, right? Like if you came to me with a 3.5-year-old and said, boo-hoo, I don't sleep, I need Ambien. Ambien is not going to fix your problem. Getting your kid to sleep is going to fix your problem. Obviously, that just is
Yeah, sleep just fix my problem.
right. Totally.
That's, I used to be a morning person before, but right now sleep is so important for me.
Yeah.
So I said, don't forget about it. I'm gonna have like full sleep. So even if in the middle of the night I have to get up and take care of my baby, I said I'm gonna compensate it and sleep again, because nothing is more than a good quality sleep. Because if you don't, whole day you are crappy.
Yes. And
And
the
you
thing is you can't life is dynamic and your body is dynamic and what you're going through is dynamic. So you can't hold yourself and your sleep patterns and your eating habits to the same expectations they were 4 years ago, and so you just have to be one with, as much as you can, the fact that it's a phase of your life. I mean, I have 3 kids. My youngest is almost 7. And I think probably, I mean, and I've always been a morning person. I've always been worked out in the morning. And yeah, probably when they were young, I was just like, it's not worth it to me. Sleep is important. I can't just force myself to get up, because that's also, then you're forcing yourself and releasing stress hormones, and it's just not good.
Yeah, I did it once. I said, oh, I'm gonna get up early, but because I didn't have good sleep like the night before, so my whole day was so bad. So I said, just relax.
Yes,
And
totally.
yeah. So I see you have a website. What do you have there?
Have a what? Oh, a
Website?
website. It just talks about the IVs that I do. So in my practice, like we spoke about in the beginning, I started, my interest in the alternative medicine space in regenerative medicine, which is a branch of medicine that uses, pretty much stimulates natural healing within your body. So whether you use prolotherapy, which is actually using an outside substance, injecting in where you kind of provide a noxious stimulus to obtain the natural inflammatory response, which is actually healing for your body, or you're using PRP, which is using your own platelets, or you're using your own stem cells um, coming from your own bone marrow and or your own fat, processing them and then re-injecting them into a patient to stimulate natural healing. Or so that's kind of part of what I do. I've kind of put what I do into maybe 4 different categories. I do functional medicine, which tries to focus on the root cause of disease, and you can do that by kind of there's so many facets of functional medicine. I don't do a ton of genetic testing because well, you can't know it all, and that gets so specific, and I quickly realized I wasn't going to learn all the things there were to know about genetic testing. And I don't think we know enough yet to like, I don't know enough to really, we're getting there, but there's just, it's complicated. So I do a lot of talking to patients again about diet. Like I think what you eat affects so much of your health, not just the obvious things like diabetes and hypertension and weight, but even things that people may or may not know, like autoimmune disease and is very much influenced by what you eat. Let's see. So I do a lot of hormones for men and women, which fall under the functional medicine, because again, that's addressing a root cause. I mean, as we get older, we start losing the amount of hormones we have. Men lose it slowly over time, where women just kind of like jump off the cliff, as we know, because we go through menopause. But even though we go through menopause, we actually start dropping our hormone levels before we actually just stop having periods. But it's still much more drastic for women than men. But people have, something like, for example, fatigue and mood changes and lower libido and just changed sex drive and skin changes. And that's all related to hormones. And so you can treat the root cause of a lot of those things by one, even though it is a medication, and you've kind of, targeted 5 or 10 different symptoms. So we're not treating a symptom for an antidepressant and then a symptom for whatever, like all of the things of menopause. I do a lot of IV vitamins for different things in general, like we talked about the IV NAD, which is very cool. But I just think IV vitamins are so awesome. I mean, I had someone in my office today who felt awful. She's been overworked. I think she's starting to get a flu. And it's a 45-minute IV with a ton of vitamin C, like all the B vitamins, some magnesium, potassium, and she walks out without a scratch in her throat. I mean, it's immediate and it's simple and it's affordable, and you're not taking meds or you're not down for the count for days because you're sick. I mean, it's just like, to me, it makes sense. So that's kind of another part of my practice, is like all the IVs I do are on my website. And then I do some aesthetics as well. So kind of, I can do regenerative aesthetics, which I really like doing, using platelets and your stem cells to just encourage collagen in your skin naturally to heal. And then I do some Botox and fillers just because like I've learned it, and people who want to feel good want to look good as well. So that's that. And I really actually enjoy it. To be honest, when I learned it over a decade ago, I was like, oh, I don't know, I didn't go into medicine to do aesthetics. That doesn't bring me joy. But now I do it because you just see patients, like they're so happy that they look a little bit better. I am not a plastic surgeon. I don't do all the things, but just a little bit of filler or Botox or microneedling, like, I don't know, people are happy, which is really my goal as a physician.
It feels good sometimes. For some.
Totally.
Yeah, you're doing so much stuff.
It's exhausting.
Skills, no, that's good. At least like your way of healing others, you use different aspects of your skills, which is fantastic, and I really appreciate it. For sharing this information for us.
Yeah, I honestly only do the things that I love doing. Patients ask me all the time, like, what do you love the most? And I'm like, I pretty much cut out everything in medicine that I don't enjoy. Oh. So everything I offer in my practice, I would do to myself.
Okay, thank you so much for being here. I really enjoyed talking to you. And
likewise.
I wish you lots of luck and success for you.
Yes, thank you. Enjoy that 3-year-old.
Yeah, thank you.